Hello everyone. So today we will discuss some of the cardiac enzyme. Enzyme of significance for diagnosis of cardiac condition are called as cardiac enzyme. GOT, CPK that is creatine phosphokinase, LDH that is lactate dehydrogenase and SHBD are enzyme of significance in diagnosis of myocardial infarction. Their determination constitute cardiac injury panel test. CPK value rise 4 to 6 hours after infusion. They reach peak in 24 to 36 hours. GOT value start rising at the time and reach peak value in 2 to 3 days. GO2 value start rising at the time and the peak value in 2 to 3 days. They stay elevated for about 14 days. CPK and GOT level does not alter in other cases of chest pain caused by pneumonia, pulmonary infections, etc. Here we will discuss the estimation test for the creatine phosphokinase. Name of the method is colorimetric method. Talking about the principle, CPK that is creatine phosphokinase enzyme will catalyze the reaction. Creatine phosphate plus ATP will give rise to creatine plus ATP. Here the creatine found in this reaction react with diacetyl and A-naphthol in presence of alkaline medium giving color compound. The color intensity is proportional to the concentration of enzyme. Talking about the requirement, test tubes, pipettes, thermostatic water bath and photoelectric colorimeter. Next we will discuss the different reagent and their composition and how we can prepare these reagent. First we have tris buffer. For tris buffer, tris aminomethylene 12.1 gram, magnesium sulfate heptahydrate 3.7 gram, distilled water up to 1 liter. Method of preparation: dissolve 12.1 gram of tris aminomethylene and 3.7 gram of magnesium sulfate heptahydrate in approximately 600 ml of distilled water. Adjust volume to 1 liter with distilled water. Adjust pH to 7.4. Stability: this reagent is stable at 2 to 8 degrees Celsius. Next we have buffer. Cysteine solution composition: cysteine 0.7 gram, tris buffer 100 ml. Method of preparation: dissolve about 0.7 gram cysteine in enough quantity of tris buffer and dilute to 100 ml with tris buffer. Stability: this reagent should be prepared freshly on the day of use. Next we have Phospho-Creatine solution. For this we required Phospho-Creatine that would be around 0.25 gram, distilled water up to 100 ml. Talking about the method of preparation, dissolve 0.25 gram of Phospho-Creatine in 75 ml of distilled water, adjust pH to 7.4 and dilute to 100 ml with distilled water. The stability of the reagent: this reagent is stored in refrigerator and stable for 2 weeks. Hence, it should be prepared freshly every 2 weeks. Next we have adenosine diphosphate solution. Distilled water up to 100 ml. Method of preparation: dissolve around 0.7 17 gram of ADP in about 75 ml of distilled water and dilute to 100 ml with distilled water. Store the solution frozen. Next we have substrate solution. For the substrate solution, buffered cysteine solution 1 part, Phospho-Creatine solution 1 part, ADP solution 1 part, distilled water 1 part. Now we will mix equal volume of buffered cysteine solution, Phospho-Creatine solution, ADP solution and distilled water. Store the solution in the refrigerator. Next we have p-chloromercuric benzoic acid. For this we required 1.1 gram of p-chloromercuric benzoic acid and NaOH of 1 normality will be equal to 25 ml. Next we have HCl quantity sufficient to form precipitate. Then distilled water up to 100 ml. Here we will dissolve 1.1 gram of chloromercuric benzoic acid in 25 ml of NaOH. Then we will add HCl until the precipitation take place. Dilute to 100 ml with distilled water. Solution become clear on dilution with 100 ml. Stability. This reagent is stable at room temperature for several months. Next we have barium hydroxide solution. We will take around barium hydroxide octahydrate 45 grams, distilled water 1 liter. Dissolve 45 gram of barium hydroxide octahydrate in 750 ml of distilled water and dilute to 1 liter with distilled water. Equal volume of barium hydroxide and zinc sulfate solution should neutralize each other. Next we have zinc sulfate solution. In composition, zinc sulfate heptahydrate 50 grams, distilled water 1 liter. Dissolve around 50 grams of zinc sulfate heptahydrate in 750 ml of distilled water and dilute to 1 liter with distilled water. Next we will prepare a stock solution of alkali. In composition we have sodium hydroxide 6 gram, sodium carbonate 12.8 gram, distilled water 1 liter. We will dissolve sodium hydroxide and sodium carbonate in 75 ml of distilled water and dilute to 1000 ml with distilled water. Stability. This reagent is stable at room temperature for several months. Next we have a naphthol solution. We will prepare this in stock alkali up to 10 ml. Next we have our standard creatine standard. Around 11 to 15 mg of creatine will be mixed in distilled water about 35 ml and then we will make up the volume to 50 ml with distilled water. For sample we have serum and we will measure the absorbance at 540 nanometer. Next we have the procedure. Take 3 tubes and label them as test, standard and blank. Now pipette into them as follows. Substrate 1 ml in test, standard and blank. Then keep the tubes at 37 degrees Celsius in thermostatic water bath. Serum in next we will add serum in test 0.1 ml and standard in standard tube around 0.1. Then we will add distilled water in blank 0.1. Continue in thermostatic water bath at 37 degrees Celsius for 30 minutes. Then we will add chloromercuric benzoic acid, barium hydroxide solution and zinc sulfate solution almost around 0.5 in 3 of the tube, 0.5 ml in 3 of the tube. Then we will centrifuge covering the tube with the plastic cap at 2500 rpm for 15 minutes. Take supernatant of the above tube into respective labeled tube 0.5 ml each and treat as follow. Then we will add around a naphthol in 1 ml in each of the tube. Then we will keep the tubes in water bath again for 37 degrees Celsius for 20 minutes. Then we'll add distilled water around 2.5 ml in each of the tube. Then we will again centrifuge for a minute. Take supernatant of above tube into respective label tube and read absorbance. OD value of test and standard against blank. Calculating the concentration of the enzyme in the specimen using the formula, concentration of CPK will be equal to OD, that is absorbance of test divided by the absorbance of standard into the concentration of the standard. Here 1 upon 30 is used to converts to 1 minute, and this 1000 upon 01 is for the 1 liter of the serum. It is for the units will be unit per liter, and the normal value of it will be around in males 20 to 50 international unit and females 10 to 35 international units. So that's all we have in this test. Thank you and have a nice day.